discuss the leprosy. Leprosy is also known as Hansen's disease. It is one of the oldest diseases in recorded history. The first known written reference to leprosy is from around 600 BC. Usually we celebrate January 27 is a World Leprosy Day for the awareness, especially in undeveloped countries and areas. Leprosy is a chronic progressive bacterial infection caused by Mycobacterium leprae, which is actually acid-fast, rod-shaped intracellular bacilli stained with Zeal-Nelson carbol fission. Leprae cannot be grown in a bacteriological media. It primarily affects the nerves of the extremities, the skin, the lining of the nose, and the upper respiratory tract. CNS, lungs, and ovaries are spared. It doesn't cause any illness in the lungs, lung parenchyma, though it involves the upper respiratory tract lining, the epithelia around the nose, but it doesn't affect the lungs, it doesn't affect CNS and ovaries, but peripheral nerve system, again, it mainly affects the nerves of the extremities. All age groups are affected equally, though male are twice affected as females. Leprosy spreads through contact with the mucosal secretions of a person who is infected. This usually occurs when a person with leprosy sneezes or coughs. Again, skin to skin, it means contact spread is again a possibility, which is very rare. The disease is not highly contagious. 95% of people who are exposed do not develop disease. But once they stay with the patient is too much, or the close contact, repeated contact with an untreated person for a longer period of time, maybe days and months, can lead to contract leprosy. Cell-mediated immunity is actually responsible for this leprosy. And again, cell-mediated is responsible for resistance to infection with Mycobacterium leprae. But a variety which is known as lepromatous leprosy, there is complete breakdown of cell-mediated immunity. The reservoirs, in the natural reservoir is a human himself, and again animals, armadillos is again a natural host for this leprosy. Classification, there are a lot of classification, Indian classifications, classification 1, classification 2, according to involvement, classification number 3, that is Ridley-Joplin classification. So we'll discuss a few of them. The first system, the first classification recognizes 3 types of leprosy. Usually they are classified most of the time you will see according to their severity. So one form is tuberculoid, other is lepromatous, and the third one is borderline. Person's immune response to the disease determines which of these types of leprosy they have. In tuberculous leprosy, the immune system is good. A person with this type of infection only exhibits a few lesions. The disease is mild and only mildly contagious. Lepromatous leprosy, as I already told you, the response being carried by leprosy is cell-mediated response. So once there is a, it has been seen that those patients or those people who have defect in cell-mediated immunity, they develop the severe form of leprosy, which is actually lepromatous leprosy. So in lepromatous leprosy, the immune response is poor. This type also affects the skin, nerves, and other organs. There are widespread lesions, including nodules. This form of disease is more contagious. Borderline is, again, as the name denotes they are clinical features of both tuberculosis and lepromatous leprosy. This type is considered to be in between the other two types. World Health Organization classifies leprosy on the basis of type and number of affected skin lesion. Passi bacillary, there are 5 or fewer lesions and no bacterium detected in the skin sample. So 5 or fewer lesions and no bacterium detected in the skin samples. And multibacillary, there are more than 5 lesions. The bacterium is detected in the skin, or maybe any smear from the nasal scrapings, from the nerves, even both the lesions, more than 5, and bacterium is detected. Ridley-Joplin classifications, which is again depend on clinically we use it. There are 5 types: tuberculoid leprosy, borderline tuberculoid leprosy, mid-borderline leprosy, borderline lepromatous leprosy, and lepromatous leprosy. This is more or less the same which we discussed in the first classification, but it is in more detail. The main outcome is this: tuberculosis leprosy is a mild form of leprosy, and lepromatous leprosy is a very aggressive form of leprosy which doesn't regress itself. There is also a form of leprosy called indeterminate leprosy that isn't included in Ridley-Joplin classification system. It is considered to be a very early form of leprosy where a person will have only one skin lesion that's just slightly numb to touch. Intermediate leprosy may resolve or progress further to one of the 5 forms of leprosy within the Ridley-Joplin system. So as I already told you, there are 2 main types. One is tuberculosis, which is the mild form of leprosy, and other is the lepromatous leprosy, which is aggressive and severe form of the leprosy. Otherwise, all other classification, just come up but down, intermingled with each other. So the thing is, once a patient have defective cell-mediated immunity, they usually develop the lepromatous type of leprosy. These are the lesions which we encounter in a patient with leprosy. In tuberculosis, just a flat. Only you will see in the duration or change in the color of the skin. In borderline, again, there is a borderline which is bit margins are, they are just coming up. So the tuberculosis is early form, a flat, only discoloration is there, but in borderline tuberculosis there is elevation in the the thickening is going to get a start over here. Again, borderline leprosy on the left and lepromatous leprosy, the full-blown nodules are there. So full-blown nodules occur in lepromatous leprosy, but just in duration or just a slight thickening in the skin is a borderline or tuberculosis leprosy. Once a patient develops nerve damage, they can develop sensory loss. And जब sensory loss हो जाता है, तो patient जब चल रहा होता है, तो उसको pain feel नहीं हो रहा होता है. So जब once a patient get irritation once again and again and again, there is he can develop these type of deformities which you are seeing on the left side. And a patient he may develop nerve damage. A median nerve damage occurs, can lead to claw hand. Just you see the first 2 fingers are flexed. So this is claw hand. Again, severe form of leprosy you are encountering here. Differential diagnosis. A patient who will come to you with the clinical features like he will see, we diagnose the patient with a physical examination to look for the signs and symptoms of the disease, and then we can go for the biopsy of the skin, or nerve, or nasal scrapings, and there is again a lepromin skin test, which is to determine the form of leprosy. So the physical examination patient usually comes with a large or small bumps with no pain, but they usually don't heal. So a patient will come to you with nodules, macules, and he'll say, I have no pain, but they are there, or they are even progressing. Muscle weakness is one of the feature, muscle weakness, and disappearance of the eyebrows and eyelashes. Muscle weakness can occur because of the nerve damage. So when the patient comes to you with these symptoms, we have to make a differential diagnosis list. So lupus erythematosus usually comes with a tuberculoid type of leprosy, and lupus erythematosus, same skin lesion, only just discoloration of the skin. Sarcoidosis, again discoloration of the skin. Syphilis, again discoloration, start with the discoloration, then move on. Erythema nodosum is again a same presentation, but usually erythema nodosum have pain in the nodules. Erythema multiforme is again a strong differential diagnosis. Cutaneous tuberculosis and vitiligo comes down the list for the differential diagnosis of leprosy. Once we will make a differential diagnosis, we interrogate, we examine the patient, we take the history, and then biopsy of the skin, nerve, or scrapings, lepromin test to determine the form of the leprosy. Now the lepromin test. Usually in the biopsy, we see this Mycobacterium leprae, and in the diagnosis of lepromin test. What is lepromin test? It is used to determine type of leprosy. Leprosy causing bacterium, which has been inactivated, will be injected in the skin, typically on the upper forearm, when there is an induration of 10 mm. Yes, there is a question that how to do differential diagnosis of leprosy. As I told you, a patient will come to you with the patient will come to you with a history of maybe nodules on the body, just only discolorations, scattered discoloration on the body, maybe disappearance of the eyebrow or eyelashes, maybe weaknesses because of the nerve damage, or sensory presentations that he may not feel sensation because of the nerve damage. So once he will come to you, you will make a list of differential diagnosis. Because ऐसा नहीं है कि जो भी patient discoloration के साथ आपके पास आएगा तो वो leprosy का ही होगा. There are other possibilities that resembles the leprosy, and in which we have a list of lupus, SLE जिसको हम बोलते हैं, systemic lupus erythematosus, sarcoidosis, syphilis, erythema nodosum, erythema multiforme, cutaneous tuberculosis, and vitiligo. Usually in these type of diseases, there are they start with the skin discoloration and then move on. So once in early stage a patient is coming to you, you can make a list of differential diagnosis, और फिर उस differential diagnosis में आप order बनाते हैं कि जो ज्यादा आपको strongly feel होता है, आप सबसे पहले कोशिश करते हैं कि उसको investigate करें. And for investigations, we have biopsy of the skin or the nerve, और फिर जो nasal scrapings होते हैं उसको हम करते हैं प्रॉब के थ्रू, और हम उसमें देखते हैं Mycobacterium leprae. or we have lepromin skin test. Lepromin skin test usually diagnosis के लिए नहीं होती है, लेकिन वो आपको determine करती है कि किस type की leprosy है, which we discussed borderline, intermediate, and lepromatous. So lepromin test is used to determine type of leprosy. Leprosy causing bacterium which has been inactivated will be injected into the skin, typically on the upper forearm. Positive reaction हम तब लेते हैं जब जो forearm में हम डालते हैं 10 mm or more in duration हो after 48 hours or 5 mm or more nodule बन जाए after 21 days. Negative in lepromatous leprosy because of the humoral immunity, not cell-mediated immunity. Again, we have yes. देखें, lepromin skin test is actually cell-mediated response. Cell-mediated immunity होती है, उसका response है. Or I already told you there is almost complete failure of cell-mediated immunity in those patients who has cell-mediated immunity deficiency or defect or failure. They actually develop the lepromatous type of leprosy. So जब cell-mediated immunity है ही नहीं, तो वो reaction होगा ही नहीं, and that's why you will get a negative response. I hope it's clear now. Yes. देखें, अगर पॉजिटिव रिएक्शन है, इसका मकसद ये है कि इट इज नॉट अ लेप्रोमेटस लेप्रोसी. नंबर 1, या तो वो बॉर्डरलाइन है या वो फिर ट्यूबरकुलॉइड है. लेकिन दिस इज नॉट एक्चुअली टू कंफर्म द डायग्नोसिस ऑफ लेप्रोसी. Diagnosis of leprosy is actually clinical, number 1. Number 2, it is on the basis of this biopsy or scraping, जिसमें हम mycobacterium देखते हैं. ठीक है. So it is if the reaction is, once you are confirming that there is a leprosy and you want to confirm that, क्योंकि मैंने आपको बताया कि ये जो demarcations है ना, ये जो leprosy की classification की, वो इतनी कोई खास नहीं है. बस माइलर फॉर्म को हम ट्यूबरकुलोसिस बोलते हैं, और अगर एग्रेसिव डिजीज है और एक्सटेंसिव डिजीज है तो हम उसको लेप्रोमेटस लेप्रोसी बोलते हैं. लेकिन फॉर दैट यू नीड टू कंफर्म, और वो कंफर्म तब होगा जब आप इसको लेप्रोमिन टेस्ट करेंगे और उसमें अगर रिएक्शन आ रहा है, अगर सेल मीडिएटेड इम्यूनिटी एक्टिवेटेड है, वर्किंग वेल, then you will not you will get a negative response. So it means it is a lepromatous leprosy. Okay. Yes, thickening of ये हम थोड़ा डिस्कस भी कर लेते हैं आगे. बिल्कुल, we are going to discuss it. So the complication, delayed diagnosis and treatment in every case lead to serious complication. So the disfigurement, hair loss, eyebrows around, eyelashes, muscle weakness, inability to use hand and feet, permanent nerve damage in the arms and legs, chronic nasal congestion, nose bleed, and collapse of the nasal septum, iritis, glaucoma leading to ultimate blindness, erectile dysfunction, infertility, and renal failure, especially secondary to amyloidosis, develop. Actually, there is inflammatory reaction due to circulating immune complexes, vasculitis, T cell reaction. They ultimately lead to this chronic inflammation and further causing the thickening of the nerves. जो आप specifically thickening of the nerve, this is actually a characteristic of this disease. So that's why it is occurring over here. Now once we confirm the diagnosis, we are now going to treat the patient. WHO developed a multi-drug therapy in 1995 to cure all types of सेम क्वेश्चन देखें, हर डिजीज का एक अपना कैरेक्टरिस्टिक होता है, ठीक है, और लेप्रोसी में यूजुअली क्या होता है कि दे हैव अ कैरेक्टरिस्टिक फीचर टू इन्वॉल्व द म्यूकोजल लाइनिंग्स, इन्वॉल्व द नर्व्स, इन्वॉल्व द स्किन. Chronic inflammatory reactions lead to the thickening of the nerves of the skin. This is a character. Chronic inflammatory reaction, vasculitis, they ultimately lead to this thickening of the nerves. So WHO has developed a multi-drug therapy in 1995 to cure all types of leprosy. It's available free of charge worldwide. So multi-drug therapy regime consists of rifampicin 600 milligrams once monthly under supervision, dapsone 100 milligram daily self-administered, clofazimine 300 milligram monthly under supervision, or 50 milligram daily self-administered. So this is the combination multi-drug therapy for leprosy. Usually we give it for 9 to 12 months. If clofazimine is unacceptable due to skin coloration, then it may be replaced by ethionamide 250 milligram daily. Leprosy reactions or lepra reactions. Again, these are inflammatory reactions due to circulating immune complexes, vasculitis, or T cell reaction, which may be induced by treatment sometimes, but they are not a side effect of multi-drug therapy. They are actually body's response to leprosy. Usually 1 to 2 patients in 10 may develop this type of reactions. Actually, one question is why it is unacceptable due to skin coloration, as in a patient who is taking clofazimine, they can cause skin coloration. स्किन में पैचेस आ जाते हैं, कलर्ड पैचेस, ऑरेंज टाइप के या डार्क ब्राउन टाइप के पैचेस आ जाते हैं, और दे कैन इवन अकर ऑन द फेस. So most of the patient usually don't feel good, so they want to change their therapy. So we can change it ethionamide, though clofazimine is class 1 and ethionamide is class 2, but again it is almost equally effective. So in those patients, we used to give this ethionamide 250 milligram daily, but clofazimine has edge because it's once monthly. So this is the only reason. Skin discoloration होती है, skin coloration, pigmentation हो जाती है, लेकिन it is reversible. When the drug is off, the coloration will be off. This lepra reactions more commonly seen in multi-bacillary cases. I mean, in those who have more than 5 lesions usually. Uh, 9 to 12 months usually it takes 9 to 12 months to treat the leprosy. Signs and symptoms include skin patches become reddish and are swollen, sometimes painful reddish nodule appear, pain in nerve, loss of sensation, muscle weakness, fever, malaise, swelling of the hand and feet. These are the signs and symptoms of lepra reactions. Leprosy reactions, early diagnosis and prompt treatment of reaction. Every patient should be informed about signs and symptoms of the reaction. पहले ही हम बता देते हैं कि जब आप ट्रीटमेंट स्टार्ट करेंगे तो लेप्रोसी बॉडी का रिएक्शन इन दोज हु हैज लेप्रोसी बॉडी का रिएक्शन हो सकता है और रिएक्शनरी रिस्पांस हो सकता है, तो ये आपको सिम्टम्स हो सकते हैं. Inform them to go as soon as possible to the healthcare, reassure the patient the reaction can be treated. These are not side effects of MDT. It doesn't mean that multi-drug therapy is not working. Leprosy reactions, again, continuous management. Rest is very important. Control of pain and fever by aspirin or paracetamol. Continue multi-drug therapy regularly. Reaction which involve the nerves, start treatment with the course of steroid as soon as possible, will control all signs and symptoms. A reaction which only involve the skin, rest and painkillers are usually sufficient. If no improvement within days or worsening, then a specific treatment, maybe again with the steroid, will be helpful. Multi-drug therapy is not contraindicated in patient with HIV infection. Multi-drug therapy is safe during pregnancy, except thalidomide, which we usually give in aggressive. Sometimes we can give in aggressive patients when the patient is not accepting the other drugs, can produce severe birth defects. Drugs are usually excreted in breast milk, but no reports of adverse reaction except for mild discoloration of infant skin by clofazimine. Leprosy is exacerbated during pregnancy, so we counsel them to please avoid pregnancy for at least treatment and after at least 2 to 6 months of the treatment. The lepra reactions are actually, these are inflammatory reactions due to circulating immune complexes, vasculitis, or T-cell reactions, which may be induced by the treatment. Yes, this is the answer somebody has asked. And there was a question that what is the difference in muscle weakness? Actually, there are two things. One is sensory system in the peripheral nervous system. One is the peripheral system. Other is the motor system. अगर मोटर सिस्टम की नर्व्स इन्वॉल्व होंगी तो वीकनेस होती है स्टार्ट, ठीक है. और अगर सेंसरी सिस्टम की नर्व्स इन्वॉल्व होती हैं तो सबसे पहले हाइपर एस्थीसियाज होते हैं, यानी आपको ज्यादा फील, जैसे कहते हैं ना करंट से महसूस होते हैं, इट्स लाइक दिस, ठीक है. बट वंस इट प्रोग्रेस तो वो बिल्कुल सेंसरी लॉस हो जाता है. सो पहले पेन स्टार्ट होगा, आपको पेन ज्यादा फील होगा, कुछ थोड़ी भी हिट होगी, थोड़ी भी चीज लगेगी तो आपको ज्यादा फील होगा करंट लाइक. और वंस इट गोज ऑन तो आपको फिर नंबनेस और पैरेस्थीसियाज स्टार्ट हो जाते हैं. सो राइट फ्रॉम द पेन, हाइपरेस्थीसियाज to leading to पैरेस्थीसियाज, यानी हाइपर ज्यादा फील, ज्यादा सेंसेशन महसूस होती है, एंड देन अल्टीमेटली कंप्लीट लॉस होगा तो फिर no, I said CNS, lungs and ovaries will be spared. So it will not involve the central nervous system, but yes, peripheral nervous system it can involve. Is erythema nodosum leprosum lepra reaction? I don't think so, because erythema nodosum leprosum I have not heard. I'm not sure about it, but erythema nodosum, yes, erythema nodosum is a strong differential diagnosis, but it is not lepra reaction. So the conclusion. Uh, Fortunately, Alhamdulillah, modern medicine has cured most of the world from leprosy. People with leprosy are being more accepted by communities around the world. Leprosy still remains a problem in under or undeveloped countries. WHO is putting a stop to this, and if they reach their goal, leprosy should be eliminated from the world within 20 years. Or Okay, जब treatment we complete treatment for 12 months, we is 100% cure. There in leprosy there is 100% cure. So we'll congratulate the patient. We'll thank to the family, friends for their support. Reassured that multi-drug therapy completely cure the disease. ये फिर नहीं हो सकता. Reactivate or any residual lesion will fade away slowly. कभी कभी क्या होते हैं लीजन नोड्यूल्स इतने एग्रेसिव इतने ज्यादा होते हैं तो वो 12 महीने में खत्म नहीं होते लेकिन दे विल फेड अवे encourage to come back in case of any problem, show them how to protect anesthetic area or disabilities. As I told you कि जब complete sensory loss हो जाता है तो जब आपको फील ही नहीं होगा तो आप कभी हाथ किसी भी चीज को गर्म चीज को लगाएंगे आपको फील ही नहीं होगा तो that ultimately leads to damage and again या आपके पैर अगर उसमें सेंसेशन नहीं होगी तो वो जमीन से रगड़ रगड़ के क्योंकि आप जब पैर रखते हैं तो ये सेंसरी सिस्टम होता है जो एक्टिवेट हो जाता है जो आपको उन रगड़ों से उनसे बचाता है एक सेम स्टेप आप ले रहे होते हैं एंड अगर मोटर सिस्टम भी इन्वॉल्व हो जाए तो फिर तो फुट ड्रॉप और ये सारी चीजें होती हैं जिसमें पैर रगड़ 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 के और डिफॉर्मिटीज हो जाती है So again, how common in Pakistan? Though we are in underdeveloped country, Alhamdulillah, we have very rare. Leprosy is more common even in India. It's not that much common. There are few countries where leprosy is common. Yes, wrist drop and foot drop. Again, these can occur in leprosy. देखिए third year level you don't need to go for the doses of the drugs, but yes, side effects which I haven't covered but because you will cover these side effects in the ATT, which is anti-tuberculosis therapy. So the side effects are a bit more important than this dosage. Yes, MDT can be given in children, but there is slight change again in dosage. But yes, we have to give it in the children as well. Less than there is a cut mark is 14 years. Less than 14 year and above 14 years is the same adult therapy. But if a patient is less than 14 years, then there is slight change in the treatment in the dosage, especially. So hope you have got this leprosy bit well. Clinical aspect है कि usually no, there is no vaccine available to prevent this disease, but the treatment is 100% cure. And leprosy usually is the same type of bacteria with almost resembles to the Mycobacterium tuberculosis. So again, granulomatous lesion, chronic inflammation, they can lead to the thickening of the nerves in the skin, leading to macules and then nodules. So I hope you everything has been clear to you. We are now again there are a few questions. देखें ये कोई हार्ड एंड फास्ट नहीं है कि ट्रांसमिशन अगर एक पेशेंट में है और आप उसके साथ क्लोज कॉन्टैक्ट में हैं और सेम रूम शेयर कर रहे हैं तो इट लीज फॉर नॉट फॉर मिनट्स और आवर्स इट इज बियॉन्ड आवर्स एंड मे बी आवर्स मे बी डेज एंड ये कोई एक दो घंटे बैठने से या टच करने से नहीं होता है लेकिन अगर आप ज्यादा टाइम स्पेयर कर रहे हैं इन अ क्लोज एनवायरनमेंट देन इट कैन गेट ट्रांसमिट so the skin or contact transmission through skin is very rare. Yes, there is a question that Dr. Ruth Pao worked with these patients but didn't develop the disease. Again, देखें हम आजकल इसी रुत पाव सिविल हॉस्पिटल में कोविड के साथ काम कर रहे हैं और इसका मकसद ये नहीं है कि हर पेशेंट जबकि कोविड की ट्रांसमिशन तो 1000 टाइम्स मोर देन दिस लेप्रोसी है तो इट डजंट मीन आप अगर प्रिवेंटिव मेजर्स ले रहे हैं तो ये जरूरी नहीं है कि आपको ट्रांसमिट हो सो दिस वुड बी द केस आई थिंक ओवर देयर Yes, lepromatous. I told you that lepromatous leprosy is the severe form of leprosy, and it occurs. It has been observed in vitro that it occurred in those patients who have almost complete failure of cell-mediated immunity. So you can you can say that these patients who has lepromatous leprosy, you can assume that they have failure of cell-mediated immunity. Okay.
यस सर अस्सलाम वालेकुम
वालेकुम सलाम
जी सर एंड कर दूं लेक्चर
बिल्कुल बिल्कुल एंड कर दें
ओके सर अल्लाह हाफिज़ अस्सलाम वालेकुम
अल्लाह हाफ़िज़।